Picture this. You are at home on a quiet day. Maybe the TV is on in the background. Maybe you are reading, folding laundry, or getting ready for bed. Then your body sends a strong signal. Pressure or tightness in the chest, discomfort that spreads into the arm, the jaw, the back, or the upper stomach. Breathing suddenly feels harder than it should. You feel sweaty or unusually weak, and the scariest part is this. You are alone. If you have ever thought, what would I do if something serious happened and nobody was here, this video is for you. Here is what matters most in a moment like that. The first minute sets the direction for everything that comes next. Not because you need to do something complicated, but because you need to do the right simple things in the right order. Most people do not have that order in their head. They freeze, they try to tough it out, they walk around hoping it passes, or they do things that waste precious time. Today I will walk you through 7 practical steps to use if you ever have warning signs of a serious heart emergency while you are alone. This is not a replacement for emergency care. This is a calm plan to help you act, stay as stable as possible, and get help to you faster. One more thing before we start. I am not speaking as your doctor. I am speaking as someone who wants you prepared. If you have known heart conditions, talk with your clinician ahead of time about your personal emergency plan, including which medicines you should or should not use. Now let us begin with step number 7, because preparation is what turns panic into action. Step 7. Build a simple emergency communication setup. Most people think, I have a phone, I am fine. But during a serious heart event, thinking can get foggy very quickly. Fingers can tremble, words can get stuck. Even your memory can feel unreliable. This is why a good plan does not depend on perfect focus. Do this today while you are calm. Write your full address on a bright card. Include apartment number, building name if you have one, gate code, and any entry instructions. Tape one card next to the main phone and put another where you spend time, like the living room or bedroom. If you live in a building with a front desk or security, add the phone number for them too. Next, set up a one-touch emergency call. On most phones, you can add an emergency contact widget or speed dial. The goal is simple. One button, not several steps. When coordination feels off, fewer steps is safer. Keep your phone within arm reach at night, not across the room, not charging in the kitchen. If you use a charger, use a longer cable or keep a small charging pad near the bed. If you live alone, consider a medical alert device. The most important part is not owning it. The most important part is wearing it consistently, including in the shower if it's waterproof. People often remove it for comfort, then forget to put it back on, and that defeats the whole purpose. Also, pick one trusted person nearby. A neighbor, a building manager, a friend in the same complex. Share a spare key only if you truly trust them, and agree on a simple check in routine. The goal is not to worry people. The goal is to reduce time to entry if responders arrive and you cannot get to the door. This brings us to step 6, a technique people talk about a lot, and one that needs clear guidance. Step 6, about forceful coughing when you feel faint. You may have heard about something called cough CPR. Let me say this carefully. For most people at home, this is not a primary plan. It is not a substitute for calling emergency services. And it is not something you should rely on to manage a suspected heart attack. However, there is a narrow situation where emergency dispatchers and clinicians sometimes mention forceful coughing. If a person is still fully awake, feels suddenly faint, and believes their heart rhythm has become very irregular. In that specific moment, a strong cough can briefly raise pressure in the chest and may help you stay awake long enough to make the call and get into a safer position. If you choose to remember this, keep it simple and safe. If you feel you might pass out and you are still alert, sit down immediately. Take one deep breath then cough hard from deep in the chest. Then take another deep breath and cough again. The rhythm is steady, about every couple of seconds, but you stop as soon as you can make the call, and you do not use this instead of getting help. If you are unsure what is happening, do not spend your energy trying to do a technique perfectly. Your main job is to get help started and to put your body in a position that supports breathing and stability. Now let us talk about something many people have heard of, but few people use correctly. Step 5. The aspirin plan that is actually practical. Aspirin is often recommended in the early response to a suspected heart event because it can reduce blood clotting. That can be helpful in some situations, but it is not for everyone. If you are allergic to aspirin, you do not take it. If a clinician has told you to avoid it because of bleeding risk, you follow that plan. If you are unsure, the safest move is to call emergency services first and follow their guidance. If aspirin is appropriate for you, and you have been told it is okay as part of your emergency plan, the way you take it matters. Chewing a standard tablet can help it work faster than swallowing it whole, because it begins absorbing sooner. Many emergency protocols use one regular strength tablet or several low-dose tablets to reach the typical emergency amount. Keep aspirin where you can reach it easily and check the expiration date a couple of times a year. If you already take a daily low-dose aspirin, do not assume that means you should automatically take more during symptoms. Some people are told to, some are not. This is why I recommend you ask your clinician ahead of time. If I have warning signs, should I chew aspirin and how much? Now we move to a step that sounds simple, but can make a real difference in how you feel while you wait for help. Step 4. Use a supportive body position. When people feel chest pressure or shortness of breath, the instinct is often to pace, bend over, or lie flat. But there is a position that often helps the body work a little easier. If you have warning signs of a heart emergency, sit upright at about a 45-degree angle. You can lean against a wall, a headboard, or pillows on the couch. Bend your knees slightly and keep your feet supported on the floor. This position can reduce strain, can make breathing feel easier, and can help you stay steady. Loosen tight clothing right away. Unbutton the collar, loosen the belt, remove a tight scarf or tie. Small things can help breathing feel less restricted. Keep the room comfortably cool. If you are sweaty, do not bundle up. Open a window if you can do it safely without walking far. Fresh air can help you feel less panicked, but do not go outside. Staying inside keeps you in a known place where responders can find you. If you begin to feel faint, do not try to stay standing. Lower yourself slowly to the floor using furniture for support. If you are on the floor and you are alone, it is often safer to turn onto your side in a recovery position. This helps keep the airway clear if nausea happens. If you can, keep your phone near your face. Now let us move to a skill that helps your body stop feeding the panic loop. Step 3. Use controlled breathing to reduce strain. When people get frightened, they breathe fast and shallow. That can make dizziness worse and can increase discomfort. Controlled breathing is not a cure, it is a stabilizer. It helps you stay calm enough to follow your plan. Here is a simple pattern. Breathe in through your nose for a slow count of 4. Let your belly rise more than your chest. Hold gently for a count of 2 or 3, not forcing it. Then breathe out slowly through pursed lips for a count of 6. Like you are slowly cooling soup on a spoon. That longer exhale matters. It signals your nervous system to lower the alarm response. It can slow the heart rate a little and reduce the feeling of air hunger. If counting feels hard, do this instead. Slow in, pause, long out. Keep your shoulders relaxed. If you're on the phone with emergency services, you can count softly out loud so they know you are still responsive. You do not need to do this perfectly. You just need to avoid rapid, shallow breathing if you can. Now we go to a step that many people never think about, but it can shorten the time it takes for help to reach you. Step 2. Unlock the door and make your home easy to enter. If you are alone during a serious heart event, the biggest avoidable delay is a locked door. Responders may arrive quickly, but if they cannot get inside, minutes can disappear. So here is your order. As soon as you recognize serious warning signs, unlock your front door while you still have strength and coordination. If you can, leave it slightly open. If you live in an apartment building, unlock your unit door and, if possible, also unlock any extra interior doors that could slow entry. Turn on the lights, especially near the entry. A bright home is easier to confirm and easier to navigate quickly. If you have building security or a front desk, call them right after you call emergency services. Tell them to expect responders and to guide them to your unit. If you have a whistle, keep one on your nightstand or keychain. If you cannot speak loudly, a whistle can be easier than a voice. You can also prepare an emergency information sheet and tape it inside the front door at eye level. Put your name, date of birth, key medical conditions, allergies, and current medications. This can save time when responders begin care. Smart locks can also help if you already use them, but do not buy technology you will not feel comfortable using. The simplest system is the best system. Now we arrive at step number 1. This step needs extra care because it involves medication, and medication must be personal. Step 1. Your personal emergency medication plan, and what to do in the first 3 minutes. Let us talk about the most powerful idea in this entire video. In a heart emergency, the goal is not to be brave. The goal is to be fast and organized. And for some people, the difference is having an emergency medication plan already approved for them. Many viewers have heard of nitroglycerin. Some people carry it for chest discomfort related to the heart. It can relax blood vessels and reduce the heart's workload. For the right person, used the right way, it can bring meaningful relief. But it is not a medicine to experiment with. It is not appropriate for everyone, and it can cause a sudden drop in blood pressure which can lead to fainting. So here is the right way to think about it. If you have been prescribed nitroglycerin by your clinician, and you have been instructed to use it for chest discomfort, then your job is to follow your exact instructions. Not a guess, not a routine from the internet. Your instructions. If you do have it prescribed, most emergency plans share the same safety foundations. First, sit down before you use it. Never take it standing. You want to prevent a fall if your blood pressure drops quickly. Second, use it the way it is designed to be absorbed. Many forms are tablets that dissolve under the tongue, or a spray used under the tongue. Do not swallow it as if it is a regular pill. Let it absorb. Third, track time. Many plans use a repeat dose after a short interval if symptoms are not improving, with a firm limit on total doses before emergency help takes over. That timing matters. Guessing and repeating too quickly can make you feel worse. Fourth, store it correctly. Keep it in its original container, protected from heat and light. Replace it when your pharmacist or clinician recommends. Some forms lose strength over time, and you do not want to rely on something that is no longer effective. Now here is a crucial warning that must be said clearly. Nitroglycerin can be dangerous if combined with certain medications, especially medications used for erectile function. If a person has taken those within the last day or two, nitroglycerin may cause a severe drop in blood pressure. This is one reason I recommend an emergency medication card in your wallet, and it is one reason I recommend you speak with your clinician ahead of time about what is safe for you. Now let us put everything together into a simple first-minute plan. This is the part you can practice. The first-minute plan when you are alone, recognize the warning signs and treat them seriously. Chest pressure or tightness, discomfort spreading, trouble breathing, unusual sweating, nausea, sudden weakness, or a feeling that something is very wrong. If you feel strong symptoms, do not wait to see if they pass. Unlock the door first. Do it immediately while you can. Lights on if possible. Call emergency services. Put the phone on speaker. Say your address first. Then say, "I am alone and I have chest pressure and trouble breathing." Do not downplay it. Sit in a supportive position. Upright at about 45 degrees, loosen clothing, keep the phone close. Use controlled breathing. Slow in, pause, long out. Keep yourself steady. Follow your clinician-approved medication plan. If you have been instructed to chew aspirin, do so only if it is appropriate for you. If you have prescribed nitroglycerin with clear instructions, follow that protocol while seated and keep emergency services informed about what you took and when. Keep communicating. Stay on the line. If your voice becomes weak, keep making sound. A dispatcher can guide you, and your voice helps them know you are still present. Now let us quickly review the 7 steps you now have in your head. Number 7. Prepare an emergency communication setup. Address card, 1 touch call, phone within reach, alert device if needed, 1 trusted neighbor. Number 6. Understand the narrow role of forceful coughing. Only as a brief bridge if you are awake and feeling faint, never as a substitute for calling for help. Number 5. Know your aspirin plan ahead of time. Only if appropriate for you, and understand that chewing can work faster than swallowing. Number 4. Use a supportive position. Upright, knees bent, clothing loosened. Cool air. Lower yourself safely if you feel faint. Number 3. Controlled breathing. Slow inhale, longer exhale. Reduce the panic loop. Number 2. Unlock the door and signal responders. Door unlocked. Lights on. Call building security if relevant. Emergency info sheet visible. Number 1. Personal medication protocol. Only what is prescribed and approved for you. Use the safe way, while seated, with timing tracked. Now I want to add one final recommendation that many people skip, and it is the easiest one to do. Practice the plan once a month. Not during an emergency. Just as a simple rehearsal. Walk to your front door and unlock it. Sit in your supportive position. Pick up the phone and pretend you are calling emergency services. Read your address card out loud. Do 3 rounds of controlled breathing. Check that your aspirin is not expired if you keep it for emergencies. Check where your nitroglycerin is stored if you have it prescribed, and confirm it is in its original container. This rehearsal takes 2 minutes. It can make your response automatic when your body is under stress. And please share this plan with someone you care about. Even if they do not live alone, the steps still matter. The more familiar these steps are, the more likely they are to be used correctly. If you want, tell me in 1 short sentence what your living situation is. Do you live alone, with a spouse, or with family? I will adapt this plan into a personalized checklist you can print and keep by your phone, written in simple, plain language. Thanks for spending this time with me today.